Diagnosis of borderline personality disorder, BPD. How is BPD diagnosed? The diagnosis of borderline personality disorder, BPD, can be a complex process, as it involves assessing a pattern of behavior and emotional responses that have persisted over time. BPD is a disorder that primarily affects an individual's emotions, relationships, and self-image, often making it difficult for them to manage intense feelings and navigate social situations. In this episode of the Borderline Personality Disorder, BPD, podcast, we will dive into how BPD is diagnosed, the tools and criteria used by mental health professionals, and the challenges involved in accurately diagnosing this disorder. The role of a mental health professional. The diagnosis of borderline personality disorder typically requires the expertise of a licensed mental health professional, such as a psychiatrist or psychologist, who can assess a person's symptoms and history in a thorough, careful manner. Because BPD shares symptoms with several other mental health conditions, an accurate diagnosis often requires ruling out other potential causes of the behaviors and emotions the person is experiencing. Diagnosis is primarily based on clinical interviews, patient history, and the use of specific diagnostic criteria from the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which is the standard manual used by mental health professionals to diagnose mental health conditions. It is also common for a clinician to use additional assessment tools, such as questionnaires, self-report scales, and interviews with family members or close friends, to gather more information about the individual's behavior and relationships. Diagnostic criteria for borderline personality disorder, BPD. According to the DSM-5, the diagnosis of BPD is made when a person exhibits a persistent pattern of behavior that involves instability in relationships, self-image, and emotions, as well as impulsivity in at least 5 out of 9 specific areas. These symptoms typically emerge in early adulthood and are present in a variety of contexts, including social, personal, and professional settings. The DSM-5 criteria for BPD are as follows. 1. Frantic efforts to avoid real or imagined abandonment. This can involve drastic actions to avoid being abandoned, such as clinging behaviors or self-sabotage in relationships, especially when the person with BPD perceives a threat to their emotional connection. 2. A pattern of unstable and intense interpersonal relationships. This is often characterized by splitting, where a person may see others as either all good or all bad, leading to emotional extremes in their relationships. 3. Unstable self-image or sense of self. People with BPD often experience dramatic shifts in their self-identity. They may struggle to understand who they are, what they want, or how they relate to others, leading to feelings of emptiness and confusion. 4. Impulsivity in at least 2 areas that are potentially self-damaging. Examples include reckless driving, substance abuse, gambling, or spending sprees. These impulsive behaviors are often attempts to cope with emotional pain. 5. Recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. Individuals with BPD may engage in self-harming behaviors, such as cutting, or have recurring thoughts about suicide, often triggered by emotional distress. 6. Affective instability due to a marked reactivity of mood. This refers to rapid mood swings, often triggered by interpersonal stress or emotional strain. The person may feel intense emotions that seem disproportionate to the situation, such as extreme sadness, irritability, or anxiety. 7. Chronic feelings of emptiness. Many individuals with BPD report a deep sense of emptiness or emotional numbness, which can be overwhelming and difficult to articulate. 8. Inappropriate, intense anger or difficulty controlling anger. This may manifest as frequent outbursts of anger, physical fights, or feelings of rage that are disproportionate to the situation. 9. Transient, stress-related paranoid thoughts or severe dissociative symptoms. During times of stress, individuals with BPD may experience feelings of paranoia or detachment from reality, often referred to as dissociation. To be diagnosed with BPD, the person must meet at least 5 of the above 9 criteria. It is important to note that these behaviors and emotions must be chronic and pervasive, affecting multiple areas of life, rather than being isolated incidents. The importance of a comprehensive assessment. A comprehensive assessment is crucial for an accurate diagnosis of BPD, as its symptoms often overlap with other mental health conditions, such as depression, anxiety disorders, post-traumatic stress disorder, PTSD, and other personality disorders. A skilled clinician will take great care to differentiate BPD from these other conditions, which may share some symptoms but have distinct diagnostic criteria. Differentiating BPD from other disorders. Mood disorders such as depression may share symptoms of emotional instability and intense mood swings, but they do not typically include the interpersonal and identity-related issues seen in BPD. Post-traumatic stress disorder, PTSD, can also involve emotional dysregulation and relationship issues, but BPD is more focused on difficulties with self-identity, impulsivity, and the chronic nature of interpersonal struggles. Other personality disorders, such as narcissistic personality disorder, NPD, or antisocial personality disorder, ASPD, may share some behavioral traits like impulsivity or relationship instability, but the motivations and emotional responses of those with BPD are distinct, typically involving a deep fear of abandonment and a struggle for emotional validation. The role of self-report and structured interviews. Mental health professionals often use structured interviews and self-report questionnaires to help assess symptoms and gain a clearer understanding of a person's condition. One of the most commonly used tools is the Diagnostic Interview for Borderlines, DIB, which is designed to assess BPD symptoms based on the DSM criteria. In addition to structured clinical interviews, people with BPD may also be asked to complete self-report measures such as the Borderline Evaluation of Severity over Time, BST, or the McLean Screening Instrument for Borderline Personality Disorder, MSI-BPD. These tools provide valuable information about the severity of symptoms and can help guide treatment planning. The challenge of diagnosing BPD. One of the key challenges in diagnosing BPD is that it is often misunderstood or misdiagnosed due to its overlapping symptoms with other conditions. Additionally, BPD is often perceived negatively by both mental health professionals and the general public, which can lead to biases in diagnosis. For example, individuals with BPD may be perceived as difficult or manipulative, which can create barriers to receiving an accurate diagnosis and appropriate care. Another challenge is that many individuals with BPD may not seek help until later in life, when the symptoms have already caused significant distress and impairment. As a result, BPD is often diagnosed in adulthood after years of struggles with relationships, work, and emotional regulation. The importance of early diagnosis and treatment. Early diagnosis of BPD is crucial because it allows individuals to begin treatment at a time when the symptoms are less entrenched and easier to manage. Although BPD is a lifelong condition, early intervention, especially with therapies like dialectical behavior therapy, DBT, or cognitive behavioral therapy, CBT, can lead to significant improvements in emotional regulation, interpersonal functioning, and overall quality of life. Conclusion. The diagnosis of borderline personality disorder, BPD, is a careful and multi-step process that requires a thorough clinical evaluation. The DSM-5 criteria provide a framework for diagnosing BPD, focusing on the emotional instability, impulsivity, and relationship difficulties that characterize the disorder. A skilled mental health professional, using structured interviews, self-report measures, and careful clinical judgment, can help differentiate BPD from other mental health conditions and arrive at an accurate diagnosis. With proper treatment, individuals with BPD can learn to manage their symptoms, improve their relationships, and lead fulfilling lives. In future episodes, we will explore the diagnostic challenges, treatment options, and coping strategies available for those with BPD. Stay tuned as we continue our deep dive into the complexities of borderline personality disorder.